Welcome to another episode of What Did the Patients Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are providing you answers to frequently asked questions and bringing you inside information from real conversations we have with patients on a daily basis. Our goal is to spread the truth on health and healing because we believe everyone deserves to know the answers. Hi guys, welcome back to another episode of What Did the Patients Say with myself, Dana Brindisi, and today we have a special guest, Dr. Rachel Vitale. She is a school counselor in Ohio. She has her PhD in counseling education and supervision. Dr. Rachel reached out to us asking us to answer some questions for her about dysautonomia because she has noticed some trends in her school district. And she wanted to be able to help her students a little bit better and have a little bit better understanding of potentially what they could be dealing with. Rachel herself was diagnosed with dysautonomia a few years ago. And I think that's really what floored her passion to kind of help others and get this information out there. So we're super excited to have her on the podcast today to answer some of those questions and hopefully answer some of your questions as well. So Dr. Rachel, thank you for being here. We really appreciate your time. And I kind of wanted to open the floor to you initially to kind of give some more background, not only on your education, I think that's super important, and also your journey with dysautonomia and diagnosis and treatment if you've had any, but anything that you would be open to sharing with everybody, I think that would be great.
Oh, thanks, Dr. Dana, and thanks for asking me to come on and be with you today. I'm so excited to be able to raise awareness about dysautonomia. It is such an important topic and obviously near and dear to my heart. So I think that a lot of people have a lot of these questions, the ones that I approached you with initially, and then others also. So a little bit more about my background. I have been a practicing school counselor for 10 years. I have a PhD in counselor education and supervision. And I also myself have a diagnosis of dysautonomia, which is what prompted me to want to learn more about it. A couple of years back, I had a student who was having multiple fainting episodes at school. It kind of got brushed off as anxiety, but something didn't sound right about that to me. And eventually it took her a couple of years, but she did get her diagnosis of a form of dysautonomia. She has POTS. So I know that she had to go through that struggle, and I want to raise awareness for other school counselors, school nurses, teachers, of things to look for to maybe help educate students and parents about what this might be or what might be happening, so that people can get earlier treatment and start to feel better sooner. Nobody should have to feel like this.
That's true. That's awesome. Do you feel like there has been an uptick in these situations in your school, or is it just that you have more awareness of them, or what do you think is going on there?
I think I just have more of an awareness of it, just because of my own personal journey. When that student was experiencing symptoms, it was just before I was diagnosed, and I was Googling, like, why am I always fainting, or why is this happening to me? And it kept coming up, POTS, and eventually I got the right cardiologist, and he did the right tests, and my suspicions were confirmed that I do have a diagnosis of dysautonomia, not POTS. I have inappropriate sinus tachycardia and neurocardiogenic syncope. But knowing what triggers it, has helped me so much in managing my symptoms much better. And I want others to have that same experience too.
Yeah, absolutely. And we find a lot of these dysautonomias, POTS and IST, have a lot of similarities. Obviously, the neurocardiogenic syncope can go hand in hand with either one of those, or it can be a diagnosis in and of itself. People have different forms of dysautonomia. Some people think that you have to be passing out. So I think, when you reached out to us, the original, question was, why are these kids kind of being diagnosed with anxiety first and foremost, and they're passing out like in the hallway at school or things like that, right? And Dr. Rachel and I had spoke previous to this video, and then at the end we decided, oh man, we should have recorded that, because that was a lot of good information, and probably things that other school counselors, teachers, school nurses, right, want to know. But I think that was really the big question. You're like, why are these kids getting diagnosed with anxiety? But my point is that people can have dysautonomia whether they're fainting, so syncope is when people are passing out, they're losing consciousness, or not, right? So I think that's a big misconception about dysautonomia, and especially when we talk about POTS and IST, that like you have to be fainting in order to have it, right? The other thing we talked a lot about was the fact that the physical symptoms of dysautonomia really mimic the physical symptoms of anxiety. And I think one of your first questions was, how do you guys maybe differentiate between a student that has anxiety versus a student that you might want to put up your radar a little bit to say, hey, maybe they're dealing with dysautonomia, not just anxiety or a mental health condition?
Yes, absolutely. How can a teacher tell, or a school nurse or a counselor, how can we tell on our end that there's something more going on here, that this isn't just anxiety?
Yeah.
What might we be on the lookout for?
Yeah, I think one of the biggest things is, when are they having their symptoms, right? We know with dysautonomia, a lot of the issue is as people move against gravity, right? They tend to become more symptomatic, right? So when they've been sitting for a long time and they go to get up, which in middle school and high school, right, is something that they do all day long, right? They're sitting in a classroom for an hour, right? They're not moving, they're paying attention to the teacher at the front, right? They're learning their lesson, and then all of a sudden they've got a few minutes to rush to their locker, at least that's when I was in school, right? Rush to my locker, put away my folder, my books for one class, grab them for the other class, like run upstairs and, be in the seat in math class, all in like 4 minutes.
That changed.
It has or has not?
It has not. School is pretty much the same.
Okay. So I think those transitions between class, I think, can be a very common time for students, again, because they've been sitting for a long time. And the thing with these dysautonomias is they're not getting adequate blood flow. Their blood is not moving through their body the way that it should, and the way that blood moves through other people's body that doesn't have dysautonomia, right? So when they're sitting for a long time or lying down, it poses a little bit more of an issue for them, and they have to move a little bit slower. And you might notice this as well for yourself. So I think understanding when those symptoms are happening, another thing that we see with a lot of dysautonomias, and these are generalizations, right? Every person is different and everybody's symptoms can vary a little bit. We see that for a lot of these dysautonomias, especially things like POTS and IST, their symptoms are much worse in the morning. So are these students, often coming in late to school, or, struggling to get up in the morning, and, people might think that it is anxiety and there's something going on at school and they don't want to go, right? And they kind of slowly make their way. That's very common. Usually they do feel a bit better towards the end of the day. The more when they eat and they are fully hydrated, they usually do better, right? So we see students who, they're skipping lunch, or they're not drinking enough fluids or things like that, right? So I think that's always a good question to ask, like, are you hydrated enough? Are you drinking, right? Do you notice that your symptoms are worse when you're dehydrated? Those types of things. I think those are the big ones, especially when we're talking about young kids, right? And the way that their day-to-day works with school and all of that transition.
So what I'm hearing a lot is those positional changes are triggers. Standing for too long. I know you didn't really say it this time, but when we were talking the last time, and you don't really have kids with this, but standing in line at the grocery store, or standing in line for lunch even,
Standing in line for lunch, if they have to give a presentation, right? Which can be another thing that's very anxiety provoking, right? Public speaking. But if they're doing all right and they have to stand in front of the classroom and give even a 5 to 10 minute presentation, right? People don't think that's a long time, but for somebody with dysautonomia, standing still is probably one of the biggest triggers. So that's a good point. Yeah, we talked about the grocery store, but when we're talking about students, like plop them lunch line, presentation, right?
Exactly.
For sure.
So some other triggers, you mentioned in the past that heat, like exposure to heat, might be something with temperature regulation that might cause a fainting episode or symptoms to increase.
Yes, absolutely. I don't know if that's something that you guys experience as often, like while the students are in school necessarily, but I know that there are some schools where students have like go outside and they transfer between different buildings and things like that, right? If it's hot and it's getting close to the end of the school year, we're close to summertime or at the beginning of the school year, those might be challenging times for them as well.
I know you're in North Carolina, but here in Ohio, not all of our schools are air conditioned. Just because of when the school year starts and ends, it's just a couple of months. So, if you have a 90-degree day and you have school, that could be something that is triggered.
Yes. Yeah. And I think I asked you a question last time, like, why do you think that a lot of these students are just being pegged for it is anxiety? What do you think is causing that kind of generalization?
I know we talked about this a little bit the last time, and sometimes they've been told oh, you're just anxious, you're just stressed out right now, and they take it and run with it, and they're like, okay, I guess I was stressed out, and that's why it happened. It seems like a very convenient definition of like, oh, well, your heart rate's up and you got sweaty, and then you were on the ground, so you must be having an anxiety attack. I can tell you internally, it feels nothing like anxiety. You're just standing there having a conversation just as we are right now, and then all of a sudden you're on the ground going, what just happened?
Yeah.
So, but to an outsider who's not internally experiencing what the person with dysautonomia is experiencing, I could see where it would appear that way. And if that's what's convenient, that tends to be what we run with.
Yeah, and of course, if your teacher or your counselor or your parents, right? Somebody of some sort of authority to you is telling you, oh, you're just anxious, right? As a kid, I would have said, oh, I guess so, right? Like you don't probably even necessarily 100% understand exactly what that means sometimes, right? And so if you're being told it, then they're just like, oh, okay. And, we hear that clinically all the time, every single day. It's people with these dysautonomias. So many people have the same exact story. And I hear from a lot of patients that, they've had symptoms since they were young. Right. Or, maybe there's some glimpses that once they realize what's going on or, once they have full blown dysautonomia, right. They're like, oh, I used to have these things when I was little. Right. I'm like, and they're being chalked up as kind of like quote unquote normal. Like I hate that term, but that's what they're kind of like, oh yeah, that's just me. Right. I've always said that. Or that happens to my mom too. So like, it's fine. Right. Like, no. And I think for a lot of people who don't understand what this is, the best kind of explanation or thing that I can tell people is a lot of us have experienced, maybe you're a little bit dehydrated, you get up too fast and you're like, ooh, I feel a little bit dizzy, right? That I think is something that all dysautonomia patients can relate to, but I think a lot of people who don't have dysautonomia at some point in their life has had that experience where they're like, wow, I got up too fast, right? And things kind of feel like a little like blurry or whatever. And you're like, woo. And like maybe it's happened once in your life, right? It's that on steroids for people who have dysautonomia, right? And there's a whole host of other symptoms that kind of come along with it. But I think when you're talking to these students, it's very, very important to make sure that they're not just being put into this box of they have anxiety. And the thing that we talk to everyone about a ton is that you can also have two things. And that I think is very important for, especially for counselors and school nurses to understand, is most people with anxiety aren't passing out on the floor in the middle of school, right? Like
Yes.
they're anxious, right? And they have some of these symptoms of like, oh, their heart rate's high. They might be a little sweaty. They're kind of like, oh my gosh, I have to sit down, or they're having like a little bit trouble breathing. Most of the time they're not passing out, right? But also, is that happening when they're in a situation that shouldn't be anxiety provoking, right? We all have a little bit of anxiety. It's normal when you have to get up and give a presentation at school, you know, in your Spanish class, and you're like, oh man, I've been preparing for the last 2 days. You know, and you get a little nervous, right? You might get a little sweaty and your heart rate goes up, your hands get a little clammy. That's normal. You know, and a little bit of anxiety for all of us is good, right? It kind of gives us a little kick in the rear to kind of do things and do them well, right? But I think that's a big thing for the counselors to pay attention to, right? Like, was this something that was anxiety provoking? And would you expect for this individual to have like such an astronomical response to whatever it was, right? Did they just get up and go to their locker and switch classrooms and have, you know, what maybe looks like a panic attack? Like that doesn't add up, right?
It doesn't. But if people don't know what dysautonomia is, they don't even have it on their radar to think as a possibility.
Mm-hmm.
And I think that's one of the reasons that prompted me to reach out to you. Like, how do we get people to even know what it is so they can be on the lookout for it? And maybe distinguish between an anxiety diagnosis and a dysautonomia diagnosis. And like you said, you could have both.
Mm-hmm.
But looking at when the symptoms occur, I think is really important.
Absolutely. And, you know, we talked about this a little bit last time, and we talk about this to a lot of our patients, and, you know, their, you know, parents or spouse or children or whoever is kind of like on their team to kind of help them through all of this, is that when you have these types of symptoms and you don't know what's going on, it is very anxiety provoking, right? To experience what you experience and not know why it's happening. So I think that's the other thing too. And maybe a little bit harder with kids, right? But as an adult, right, you know, when someone's like, oh, you just have anxiety, you're like, no, I don't. Like, no, I don't. Like, I was standing in line at the grocery store. I was totally fine. I had a great day. Went to yoga this morning, right? And then all of a sudden, or you have this like quote unquote episode, right? Whether you actually passed out or not, right? It's a very anxiety provoking to experience all those symptoms, right? Tachycardia, you know, sweating, or like some people get real like cold and clammy, right? Shortness of breath, things like that. Some people have those visual changes, right? And you kind of feel like, wow, I'm actually going to pass out if I don't like sit down on the floor right here.
Yes, and that's much more common than actually fainting. I think even for fainters.
Yes, absolutely. Absolutely. Cool. Do you think that is kind of helpful and paints a picture for other counselors to say, are there other like scenarios with students that you would say, hey, we run into this a lot? Like, what would be questions that we would ask? Or
I would say that the most common one is the one that gets noticed the most is when somebody gets to the point where they're fainting. If they just appear anxious, typically the thought is that they are anxious, especially if they are in an anxiety producing situation. Like if a student hasn't gone up to give their presentation yet, but knows that they have to, and they're starting to breathe heavily and panic and shake, and they might be crying. To me, that looks a lot more like anxiety than a dysautonomia does, but maybe I'm wrong.
mm-hmm. Yeah, and I think if that is something that happens consistently and maybe they're being told like, hey, you should go talk to the counselor. I think the question for you guys is this happening more than in just those scenarios, right? Do you notice this when you don't feel anxious or nervous about giving a presentation? I think that would be a big differentiating question for you guys, right? To then start to maybe dig a little bit deeper, right? And not to discount, people who have anxiety and it's severe, right? And they deal with those types of episodes and they can be extremely debilitating as well. But like you said, making sure that this is on everybody's radar. And I think that's hopefully what we're trying to do today too.
Absolutely. So what I'm hearing a lot of is ask more questions. I mean, because you know what you know. And as a counselor, I'm taught to diagnose and look at mental health conditions. So if I see somebody who's presenting and they're exhibiting signs of anxiety, and I don't ask other questions to just differentiate or find out more, then I'm going to go with this person's probably anxious and they are having panic attacks and try to treat it that way. And I've seen that happen to students in the past who actually did have dysautonomia, and it wasn't helpful. They were not responding to treatment, probably because they weren't really anxious.
Yeah.
So
there was something that you said when we spoke last that really hit home for me was that when you go through your education, one of the first things that you guys are taught is like diagnosis and to rule out any clinical physiological issue with the person that you're dealing with. And you kind of said like a lot of times, you kind of get in your groove and you're like, oh, they're sitting in front of me, so they must have a mental health issue. So therefore it must be anxiety, and kind of not forget, right? But you're like, oh, this fits this box, right? But taking a step back to say, okay, does it really fit this box? And do we need to get them to a primary care or somebody just to do a double check and make sure everything physiologically is going on? And we kind of dove a little bit deeper into that, right? Because the biggest thing with these cases is, as you know, and you probably did, right? A lot of these people get run through full tilt table tests. They go through an echo, they get a stress test, right? The cardiologist is making sure that that nothing is structurally wrong with somebody's heart, right? So, and we kind of talked about if you're just taking these kids and you're saying, okay, yep, you're good at, but you just have anxiety. So let's kind of talk about that and figure out how we can, provide some coping mechanisms for you, which is awesome and might be a little bit helpful for them. What if we're missing an underlying like structural issue for this kid?
And you are absolutely right. That is one of the things we talked about. School counselors, at least in Ohio, aren't really trained in diagnosis. Mental health counselors are. But as part of our training, we were taught, I'm dually licensed, so I also have a mental health counseling license. But as part of the training, we were taught there are many mental health conditions or physical health conditions that mimic the symptoms of mental health conditions. The one that comes to mind automatically is if you have issues with your thyroid, it can mimic signs of depression. Mm-hmm. And not in order to make sure that you're properly treating the person in front of you, you need to make sure that they've recently had a physical and addressed these concerns with their healthcare provider. I know that there are a lot of healthcare providers who are not familiar with forms of dysautonomia, though. I think COVID might be changing that, just because I've read a lot of stuff recently that has come out about it. But I think that the most important thing is that we're treating the whole person and not looking at one symptom or one issue, but looking at the bigger picture. Let's make sure that they've seen a physician. If they have a diagnosis and they've already are at that point where they have the diagnosis of dysautonomia, and they're having these symptoms, they're probably not experiencing anxiety. They're probably experiencing symptoms of dysautonomia. And but we're talking about the before they've reached the point of having the dysautonomia diagnosis. And you're absolutely right that it's just so important, and it's just good practice. to make sure that you're looking at the whole person and not just your theoretical lens, your perception of what the reality is. You need to look at everything and take in all of the information.
Yeah, 100%. And I think that this could be a good opportunity, you know, for the school counselors and the school nurses to have like a much deeper relationship, right? Because a lot of times I would imagine that they're seeing the same students, right? Like, especially if a student is having anxiety, right? And they're probably ending up at some point in the nurse's office, right? Because they're like sweating, they have a increased heart rate, right? If they passed out, I imagine they're definitely ending up in the nurse's office, right? And then they're maybe being pushed over to the counselor, and it's maybe an opportunity for both of those people within the school district to say, hey, are we on the same page with this, right? Do we think that there's maybe, you know, another thing going on, and maybe the school nurses could also help the counselors and the students to say, I think we need to run some lab work, right? I think we need to do something beyond your, you know, physical, right? Because a lot of people don't have arrhythmias and things like that the school nurse might pick up on, you know, just listening to the heart or things like that. So I think that's pretty cool. Oh, sorry, go ahead. Did you have something to piggyback on that?
Oh, yes, you said that. It just sparked in my mind. I have consulted with our building nurse in a lot of cases with students, and I've shared some really cool resources with her. I know that Dysautonomia International has some really good flyers and handouts what school nurses, educators can do to help support students with dysautonomia. And I actually just recently had a conversation with our school nurse, and we were talking about scope of practice and, you know, making sure that we're not overstepping our bounds. But I think it's just a conversation. I mean, obviously the school nurse's role, the school counselor's role is not to diagnose this. I mean, we're not qualified to. But to have that conversation with the parents of, I've noticed these symptoms, here are some resources. You should really consider following up with your child's healthcare provider about this. I think that is the number one thing that we can do on the school end of things to help our students and advocate for them when they have this health condition so that they can get better treatment earlier. There are medications that can help with regulation of heart rate. A lot of it's lifestyle though, and just awareness of symptoms. In fact, I was actually talking to my cardiologist recently, and I told him that I thought he was brushing me off when I was first diagnosed, because he was asking me things like, "Oh, do you drink enough water?" And I'm like, "What is he even talking about?" Like he just gave me a diagnosis, and now he's telling me I just need to drink water and I'll be fine. But then I learned a lot more, and I realized there's more to it than that. But that's a good way to help, though. It makes a big difference.
Yeah, and maybe at some point we can dive into like physiologically why those things help and why they make a difference, for sure. Yeah, absolutely. One of the other questions that you asked, I think, is really important, especially when we talk about in the school setting and for the counselors and students and their families, is, you know, what are the benefits for these students if they're requesting a 504 plan or any sort of accommodation at school? I think to touch on a little bit of what I had mentioned earlier of, you know, a lot of these students struggle a little bit more in the mornings, right? So do they have trouble getting, you know, on the bus to school on time, right? Those types of things. I don't know exactly how many accommodations there are for that, right? But I know that we've had some students that, like, instead of doing their study hall, right, they like take that as a first period and they come in like after that, right? And so they can sleep in a little bit longer and do things that they need to do to kind of get themselves going in the morning. But also with these dysautonomias comes a lot of brain fog, right? So we're not shunting blood appropriately. We're not getting oxygen everywhere that it needs to be as well as it should be getting there, right? And so especially when we talk about the brain and we have to pump blood against gravity, this is where these patients and students and things, they get a lot of brain fog. So, they may need some extra accommodations and some more time to like take a test and do things like that, right? Or they might need accommodations where they're giving a presentation in class and they need to sit down in order to do that presentation, right? They might need that. So I think that, and some people are more debilitated than others, right? Like we see people that are in wheelchairs that come into our office. We see people that can barely get into their wheelchair because all they can do is lay down. So I think that there's a lot of things that potentially these students can be offered with some accommodations at school. And if they're finding that because of their symptoms, they're just not keeping up with everything that they need to, I think it's really important to, one, get the diagnosis so that you know what you're dealing with, so that you can request those accommodations.
Absolutely. So you think that accommodations could be beneficial for somebody who has dysautonomia, regardless of the severity of their disability? Because I know we haven't really touched on it in our conversation, but you can't tell by looking at somebody always that they have dysautonomia. I mean, you're talking about people in wheelchairs, you can see that there's something not right, or something different. But for most people, they're just walking down the street and they look like any other 16-year-old or any other 50-year-old.
Yes.
So I know
think that's the hardest thing. For a lot of these neurological issues that we treat, brain injury, concussion, right? Dysautonomias, migraines, dizziness, right? You can't see it. People don't have a past. A lot of those people are not in wheelchairs, right? The majority of people are not in wheelchairs. And I think that's what maybe counselors can help students with a lot. Because they really struggle. And when we see kids in our clinic, they are struggling to maintain friendships and find things that they can do, right? Because going out and, gallivanting around town with their friends is not an option, right? They can't gallivant. And a lot of them are really debilitated. A lot of them are very symptomatic. And I think that's something from a mental health perspective is very taxing on anybody that deals with these conditions. But I imagine as a middle schooler and high schooler, your formative years and you're different than your peers, right? And especially if you don't know why, you don't know what's going on, right? There's kind of a lot of things happening in your body at that time, right? To then be dealing with autonomic dysfunction and everything that comes along with it. I think that's where you guys could really shine in helping these students if you know and understand what it's like. And I think it does take people like you who have the training and the background, but also have the experience of having a dysautonomia to say, like, this is different than anxiety. Like, this is what I feel like. I'm a grown adult. I know what the difference is, right?
Yes.
I can't imagine what it would be like for a young kid. And it's very sad when I see kids in my clinic who, I talk to the parents and they're like, they've lost all of their friends. They can't go do all of the things. They're not going to camp and spending summer outside, right? It's too hot. Their life changes a lot. And I think that's where maybe they do run into things like anxiety and depression as a result of, everything that they're dealing with.
So how can school counselors, people in schools, teachers, educators, school nurses better support a student after they've received that diagnosis of dysautonomia? What can they do to really help a student feel comfortable, accepted with themselves and their peers? What are some suggestions you have for us?
I think just being there and being supportive. And I think that's, it goes a long way, right? You may not be able to follow that student around and be like, hey, did you drink your, 100 ounces of water today, right? But making sure that you guys are checking in with them and, how are they doing, right? Like, I understand that you have this diagnosis, is there anything that you want to talk about? Is there anything that would make your day-to-day a little bit easier so that you don't feel left out of this thing or that thing? Or, did you have a good weekend? What did you do? Maybe as a counselor, you can help them come up with other things that they can do, right? That's not their norm. or what they're used to doing, right? Because a lot of times, like, this just happens. I don't want to say overnight, but a lot of people are like, I felt fine. And then one time I had this episode, and all of a sudden, my life has been kind of a whirlwind since then. And it's no different with these kids. I will say it progresses sometimes a little bit quicker, especially in the young females. And you guys are kind of right around that age, right? Post puberty, where a lot of these young women develop primary dysautonomias. And those are really debilitating. So I think just letting them know that they have support and that you guys understand what they're going through, right? So if we can continue to educate, other educators and counselors and nurses on, what this is like and what they're experiencing, so that you can provide the right support and questions. And I think that that's something that we hear from our patients a lot, is just that, like, they feel like there's hope out there, and they feel like someone's listening to them. Like you said, you felt like your cardiologist was dismissing you because he was talking about water, right? But if you don't give the right context, right? So I think it's kind of what you're saying and how you're saying it. So even saying like, hey, I know that summer's coming up and, you really struggle in the heat. Why don't we sit down and come up with some things that you can do this summer that'll make your summer fun, that maybe because you can't be outside all the time, right?
Those are some really great suggestions. I'm also wondering, what are your thoughts on if a student has dysautonomia, bringing teachers or other students into just like awareness building of that? I know when we spoke the last time, you mentioned the possibility of a school-wide assembly on educating people on dysautonomia, but sometimes the teachers also need to learn about it too, because they don't know.
Yeah, and maybe that's even where it's kind of what you're trying to do, is to educate your coworkers so that they have a better understanding, right? And maybe that's where it starts. And then maybe it branches out, and maybe there's a scenario where, schools can create, right? Like there's groups for everything, right? So maybe there's a group, right, for kids who have dysautonomia, because maybe they don't know, like you said, there's no one's putting a stamp on their forehead saying like, I have POTS, so probably more kids are dealing with it than they know. And I actually had one of my very good friends now, who was a patient of mine way back when, and she didn't know that she had POTS. And I diagnosed her, and she almost fainted on my table. Her heart rate went from 65 to 150. She had a full-blown POTS episode. Well, come to find out years later, she's like, my best friend is coming to see you. She came down to North Carolina. She lives in Canada now with her husband, but she came down to North Carolina to see me for an intensive week, because they were best friends. They grew up together. They didn't know that the other one had dysautonomia. My friend got diagnosed several years ago with me, but her friend has had it her entire life, and they didn't even know.
Wow. I guess it's true. If you don't have visible symptoms, and we just talked about how most of the symptoms are not visible, they're just experienced by the person.
Mm-hmm.
I feel like that's just really, it's a cool thing that they have each other for support, but how funny that they didn't even know it for all that time.
Right. And so imagine if we could create an opportunity for these kids to, meet somebody else that's dealing with the same things that they're dealing with, right? To be able to have those conversations. And then it's like, okay, maybe they go to the movies in the summertime together because it's indoors and it's air conditioned, right? As opposed to going to, outside in the park, or like going for a hike, or who knows, whatever. We used to ride our bikes everywhere, which I imagine for a lot of these people with dysautonomia, they're definitely not doing that in the 90-degree heat. So yeah, I think there's an opportunity to create an environment, not only, from the staff to the students, but maybe even within the students, that can be really supportive. And then, hopefully get the parents on board and they understand all of that as well. So is there anything that you think, at least for this first meeting together, that we want other counselors or other coworkers of yours that you think that they should know?
I feel like we covered the basics of it. I am just really curious about like the physiology behind it, like what exactly is happening to the body and why those things work. But I don't know that most people who are school counselors would be interested in hearing all of that right now, or maybe ever. I think the sole focus of this was just mostly to raise some awareness. Yep. And to provide some possible interventions that school counselors can do, ways that they can distinguish between a dysautonomia and a mental health condition, and how we can better support kids who have these conditions. And I think that you were able to answer all of my questions, and you did it very well, so thank you.
Well, thank you. I mean, what a cool world that we live in, that we're having this conversation anyway, right? That you could find us from Ohio. Where in Ohio are you?
In northeastern Ohio, near Cleveland.
Okay. Yeah, so that, you know, we could even connect is very cool. And I think it'll be really interesting to put this out there and see who has other questions, right? And do we find other counselors or school nurses that, you know, have the same questions as you and, you know, maybe want to know more, and maybe we can have another meeting of the minds and dive a little bit deeper into these things. And, you know, like I said before, I am happy to help in whatever, you know, kind of adventure you're on with your school district or outside of there, to kind of get this word out. Because like I said, all this stuff that we put out online, and probably how you found us to begin with, is just to share this information because, you know, everybody needs to know. And that's kind of like our tagline for this podcast, right? Like, you don't have to be a patient of ours, but when it comes to your health and wellness, you should have all of the information that you need. So that's what started this podcast in the first place, and it continues. So I'm so grateful that you reached out, and even more grateful that you took more time out of your schedule to hop on with me today and talk more about this. So really appreciate it, and hopefully we'll get some more questions, and if we do, then we can hop on another one and keep going.
Absolutely, and I thank you so much for taking the time to meet with me twice and answering my questions and helping me to understand dysautonomia better and understand how I can help kids with dysautonomia better. I think the thing that struck me the most is I read the statistic that it's estimated that 70 million people worldwide have some form of dysautonomia. And if you say the word dysautonomia in a group of people, most people have no idea what you're talking about. I know there are a lot of people in the world, but 70 million is a lot to have this experience and have nobody know what they're talking about. So I think it's important to raise awareness about it. And just, I had also read that the average length of time between onset of symptoms and diagnosis was an average of 5.5 years, which is a very long time to go around not knowing what's going on with your body.
Yes, and probably very anxiety provoking.
Yes. Yeah.
Yes. Well, thank you again so much. And like I said, hopefully we get this out to as many people as possible. And as always, everybody that follows our social media, like, subscribe, share. That's how we get this information out there. And a lot of people like yourself are the ones that drive these videos for us. So we're always, you know, responding to the comments, the questions, in your case, the emails that come in, to get out the information that people are looking for. So in this case, it's no different. And hopefully we can get some more counselors and nurses and teachers on board and help these students thrive, especially in their formative years. So again, thank you so much. And I look forward to talking to you again shortly.
All right, sounds good. Thank you.